Hello everyone, I'm Dr. Sneha Sharma and I'm a consultant psychiatrist. Today we'll be doing this Insta Live with a very special guest, Dr. Sucheta. Dr. Sucheta Tiwari is a specialist registrar in perinatal psychiatry in London, and she's a dear friend. And with her today, we will be discussing about a very important topic, which is pregnancy and mental health. And I think pregnancy is in any way a very new and challenging time for a woman, but at the same time, mental health during that time can take a hit, and it's very important that mental health is discussed in the context of pregnancy. And this is why I will be shortly joined by Dr. Sucheta Tiwari. Us here, and we'll shortly be starting. So if you have any questions about pregnancy and mental health, any sort of query, please feel free to ask us in the comments and we'll try to bring it up. Hi, Sucheta.
Hi, how are you?
Good. How are you?
Good, very excited.
Yes, it's lovely to have you here, and all these conversations that we've had not online. I'm glad to bring it online and on Insta Live so that we can, share all of these thoughts with people, especially around pregnancy and mental health. So, welcome. Thank you for taking out the time.
Yes, indeed. Very happy to be here and very excited to talk about this, this absolute passion.
Yes, absolutely. I know you're passionate about mental health and maternal mental health.
And maternal mental health, yes.
So you've been, just to give some context to people, you've been recently a lot more, been in the field, especially around maternal mental health. So please elaborate a bit
so
on
I
it.
mean, long winding journey, but I have some background. I think it started when I was doing a degree in public health here in the UK. At that time, I worked on my research was focused on reproductive outcomes in women in relation to experience of emotional abuse. So even then, 10 years ago, I was quite curious about how emotional health affects women's, not just reproductive lives, but their, sort of overall lives. So that's where the passion comes from. And I've done a lot of work on sort of women and gender-based violence and things like that in relation to women's health. And now after completing all of my training in psychiatry, I moved to London and I'm now doing super specializations, and one of those is perinatal psychiatry. So my current job is at a London-based mother and baby unit, which is a specialist psychiatric unit for pregnant women and women who've just given birth up to 1 year of age, and a perinatal outpatient psychiatry service. So that's sort of the background that I'm coming with. Yes.
Right. So it's sort of come a full circle.
Yeah.
And you are also like a mother.
Yeah.
So I think there can be a lot of personal insights
100%.
also along with and overlap with professional insights.
100%.
So I want to understand, maybe this is where I want both the insights, that how do you think pregnancy impacts mental health?
I think the thing that sums it up quite a bit is the phrase called matrescence, which sounds similar to adolescence, which is a sort of transformation or a rebirth or a complete change of who you are as a person. The way adolescence is sort of the transition between who you were before, which was a child, and who you're going to be, which is an adult. Matrescence is the word that encapsulates the idea of pregnancy and giving birth and raising a small child. It's not just about bringing a small child into the world and raising that child. It's also about the maternal figure or the parental figure transforming into who they are as a person. So of course any transformation comes with both challenges and growth. It's an opportunity for both, but it is a complete transformation is how I would like to phrase it.
Yes. And wherever there is a challenge and an opportunity of growth, I think a lot of factors play a role in how a person finds themselves post that transition.
100%. Yes.
So in the context of pregnancy, and mental health, how do you think individuals around the the pregnant female could support the mother well?
Yeah, I think there's a lot to be said about social support, and there's a lot to be said about the place, both in terms of the physical and the emotional environment that the mother to be finds herself. So there can be various factors, for example, what kind of a relationship is she in? Is this a supportive partnership? Was this pregnancy wanted by the mother or the couple, or was it a social expectation? That can determine how she's feeling about the pregnancy. uh, you know, what is the sort of general environment that you're living in? What are the living conditions like? What are the sort of financial and social security that she finds herself in? What is her feeling of safety about her own life, not to mention her baby's life? All of these things can affect the mother's, sort of feelings about the pregnancy. And how people can support her is, just by getting curious about where she's at, not assuming that any positive line on the urine pregnancy test is elicits an instant congratulations. Many times it does, many times it doesn't. So it can be a more complex feeling than is the sort of public view of pregnancy and maternal health, which is just pink, fluffy, floral, happy news, good news.
Yes.
It is often called good news,
Good news.
which it can be, and I think it is a completely wonderful, blissful experience. But that is a part of the whole picture, not the whole picture.
Absolutely. And I think this is where people go wrong when they try to reduce the entire experience to a single feeling. There can be a lot of complex feelings associated, and people could create space for mothers to at least vocalize. Because I see a lot of times, mothers are not even allowed to say that there's a sense of doubt or like to question or even carry that ambiguity in their conversations, because it will be met with shame or maybe, oh, you're going to be a mother, how can you talk like that? But people have to understand that if any human experience would come with a lot of complexities.
Yes.
And it's a person can arrive at a final decision, but that journey could be, it could come with a lot of feelings.
Yeah, 100%. I think there was a book by Adrienne Rich called Of Woman Born, which talked about the difference between the experience of motherhood and the institution of motherhood. And there's a difference between the two. The way the institution is looked at or talked about can be completely different to the experience of motherhood. And what we need to do as professionals and often as mothers is to create that space for that experience to thrive, rather than the institution take control of the narrative of motherhood.
Yeah, I think that's the bottom line, where even mothers and other family members could approach this situation as creating space
100%.
for a lot of conversations to happen. Be curious about what the mother is feeling, rather than being coming with your set of prejudice
about how
agendas
she should be feeling. Yes,
absolutely. Yeah. So pregnancy is associated with its own changes, hormonal changes. Does that reflect on mood? Do we know how the changes during pregnancy can affect a woman's mood or her energy levels in general, or anxiety?
And the interesting thing about pregnancy is that the hormonal changes can affect different people differently. Different people's brain receptors for what we call the sex hormones, which go through the roof. The progesterone rises first to sustain the pregnancy, and then estrogen levels are through the roof as well through the pregnancy. And we have estrogen, progesterone receptors across our brain regions that experience emotions as well. But how these hormones affect these receptors is different for every individual. So they do affect emotions. In some people, they affect them in a more negative manner. In some people, they affect them in a more positive manner. And it's not just a brain biology thing. There's sort of a baseline of biology affecting these things, but your life situation, your previous experiences, your history of mental health issues, all of that plays a role. So pregnancy is a heightened place of emotion, and what your risk factors or protective factors have been will play up even more during your pregnancy, and even more during the immediate postpartum period, just after birth. So that is something that I wish for all pregnant women to be aware of.
Yes. Absolutely. And I think the baseline, like you mentioned, so for a lot of women who have previously experienced mental health issues, so do you think when they are making a decision about being pregnant or they are pregnant, what are the factors that they should consider? What are the thoughts that should be in mind while going ahead with the journey?
Yeah. So that's a very good question. I think if women have experienced mental health issues in the past, I think first of all, they should not be scared of getting pregnant and bringing life into the world, because that can be a common thing that people worry about. But second thing, they should know that recovery is very important to their role of motherhood. Their being in recovery through pregnancy and after giving birth is very, very important. So what has helped you recover in the past, you will have to utilize those tools to remain well through pregnancy. And you might have to tinker those tools. Some people might have responded very well to therapy. So maybe, that will be a discussion to take up in your therapy. Some people will have responded well to medication. So that is a decision to discuss with your psychiatrist very closely about how to continue medication, how to change doses of medications where necessary, and alter it as the pregnancy progresses and soon after birth as well. So it will have to be a close decision that has to be made with very careful observations of how things are evolving for your mental health through your pregnancy journey and your postpartum journey. But first thing is recovery. I would never recommend that somebody in throes of mental illness or in the deep end of feeling quite low or having quite severe illness decide to get pregnant, because that is not good for anybody. But also, once recovery has happened and you're making that decision, really be insightful, really try to reflect on what has helped your recovery process and utilize those tools through the pregnancy and in the immediate postpartum period.
Yes,
I hope that made sense.
And yeah, of course. And I think this is the point where you can take in the help of professionals,
Yes.
right? Like you can be in touch with your therapist, you can be in touch with your psychiatrist, you can make that decision, understand the risk and benefits that you are coming at, and how to be involved in the whole process. And on that note, I think I want to add that a lot of times when people come in and they are making a decision of pregnancy, or in general, like public also, there's a belief that any medication is bad for the child, right? And for a pregnant mother to be on medications or to seek the support where their level of illness is to an extent where doctor is recommending medication is seen always with a sort of distrust.
Yes.
So what are your thoughts on that? Do you experience that in your practice also, that people are averse to the idea of any sort of medication, no matter what the intensity of the illness is?
Yes. So I think that's a very, very good question, because it is one of the biggest things that women come to us with, especially if they've been on medication in the past. What I will say to that is there are two things that we should know. One, there is a lot of nuance to this. And two, experts should know ideally how to read the evidence that is available. A lot of the times, in fact, a lot of doctors who are not specialists in this area, especially the area of prescribing mental health medication to pregnant women, and that's not all psychiatrists, to be honest. Yeah. Those doctors are scared that there is no randomized control trial or gold standard evidence for these medications, and therefore none of them should be prescribed. That is not the case, because some medications, yes. For example, I can take some names: valproate, carbamazepine, drugs that will affect the fetus negatively. Those are usually not prescribed to women of a reproductive age at all, or are prescribed with a lot of, in India, I have seen that people say that don't get pregnant, use some long-term contraception. So most good doctors are aware of the drugs that are actually known to be harmful. For most other drugs, yes, there is no gold standard evidence, because pregnant women are not part of randomized controlled trials. But for a lot of drugs, there is enough evidence from other types of studies. Some drugs have evidence for a very large sample size of women, where risks are known and relatively small overall. So any decision that has to be made bearing in mind the relatively small risk of a few of these drugs and the relative risk of the mother remaining unwell on both the mother and the fetus. Those risks have to be balanced against each other, and wherever the benefits outweigh the risks, my opinion is that medication should be used, because the risk of a mother remaining unwell is far more harmful both to the fetus and to the newly born child. So a decision has to be taken. It should not be taken lightly, but where the risks of remaining unwell outweigh the risk of any risk from the drugs, then a drug should be used.
Yes, and I think that's a decision which should be made in collaboration with the person who's an expert on making those decisions. So there should be a mental health professional, a psychiatrist should be involved in these decisions. Yes. And of course, like I think there can be this general agreement, which most doctors would agree with, that they would not prescribe any unnecessary medication to a pregnant female. Yes. So this is what is important, that unnecessary medicines are anyway not prescribed, but with a pregnant female, even with the bare minimum, you are very careful. Yeah. But keeping that in mind, there might be a lot of people a lot of mothers pregnant females who might require medication. Yes. Or whose symptoms might be worse to an extent where it can be impacting how they are taking care of themselves during their pregnancy. Yes. It might be so, and how they'll take care of themselves postpartum and the baby postpartum.
Yes, exactly. And in fact, if you look at the evidence of depression itself, for example, or severe psychosis, if it is left untreated, even that is linked with worse fetal outcomes, such as like
Yes.
small for gestation age babies, being underweight, not being very well bonded with the baby, which has implications for the baby's entire
Yeah.
lifespan.
So,
Treating that depression can ensure that the mother is able to connect with the baby, to bond with the baby, to make sure that the baby is fed well and grow well. So in fact, that effective treatment of mental illness in that period can have repercussions not just for the woman's life, but for the small child's life as well, longer term into the future.
Right. Absolutely. So on like within that context, I want to understand that definitely, when people are coming to you, there's a belief, and I think there's people agree that postpartum, a lot of women go through like changes, and a lot of times they experience low moods. There could be worrying, there could be this sense of inadequacy. Will we be able to be good mothers? Will we be like? There's a lot of questioning yourself, self doubt, all of that, which is part of like the normal transition into motherhood. But how to say that it's different from that transition, like what we commonly label as postpartum blues, and how is depression or anxiety, or like it's time to take a step to where you go to a mental health professional. Where should that line be drawn?
So I think so you're right in that postpartum blues are very common. Up to 1 in 3 women will experience some sort of blues, and especially if they're first time mothers, some uncertainties about how life is going to go, how we're going to cope, and things like that. Typically, these general normal worries will settle within a couple of weeks of giving birth. If with time things are not getting better, if, for example, your biological functions, for example, your appetite has gone down very low, if you're not sleeping well, despite, no mother of a small child sleeps well, but if the child is sleeping and you're still not able to fall asleep, if the anxiety is preoccupying throughout the day where you're not able to connect with the child or take care of the child, or if you're having very negative thoughts about your life, for example, that this is not sustainable, I don't want to be here anymore, it would be better if I were dead, or if the baby hadn't existed, I would not be going through this, so negative thoughts about the baby. And these are things that women struggle to talk about, especially because it's such a taboo for a mother to have these thoughts. But these thoughts can be a sign that things are not right, and it's not just a normal reaction, it's part of a mental illness developing. The other thing that I would like to really highlight is it's a rare postpartum complication, but postpartum psychosis, which is a condition that can happen to 1 to 2 in 1,000 women. So it's relatively rare, but it is still one of the most serious problems that women can experience. Yes. And that is quite a sudden development of very severe suspicions, doubts, and it can get quite dangerous quite quickly because mood tends to fluctuate quite a bit. These women in that immediate period will not be able to care for the baby, might have quite difficult thoughts about the baby, and might in fact end up harming themselves or the baby in that altered state of mind. And that is a psychiatric emergency, and they should be taken to the psychiatrist absolutely immediately. It's very treatable. The responses to treatment are very good, but it is important that they're recognized and taken for treatment. Yes.
Yeah, and I think this is something that everybody needs to hear, that there are certain emergencies which are very much preventable. The outcome can be prevented and taken care of, where there's a loss of the mother or the loss of the child. And within that, like, I think it's also important to understand that these medicines can be taken even after delivery. So you could be breastfeeding, and there are medicines which are absolutely safe for the mother to breastfeed, and the baby is not at a risk of harm. So this is also something that, I want to highlight.
Yeah. In fact, in clinical practice, what we see, I'll be completely honest with you, there are some times when we recommend that the mother is so acutely unwell after giving birth that she might need to be prescribed medicine which is not safe for breastfeeding. And for a short period, we actually suspend breastfeeding, because then it is so important that the mother get well, because otherwise it is going to be so disruptive both for the mother and the baby, that many times we will start out by prescribing medication that is safe for breastfeeding, and if that has not been effective, we will move on to a medication which might not be safe for breastfeeding and pause breastfeeding. If the mother really values continuing to breastfeed, we will encourage them to keep pumping so that the supply is maintained, but keep the infant on formula for that short period of time and treat them with medication effectively, and after that short period they can resume once that medication has been tapered off.
Because
the priority is getting the mother well.
And I think this is what people have to understand, that the priority is getting the mother well, because the short term things like, breastfeeding or how long somebody has breastfed could have outcomes on health. But if compared in absolute terms to whether a mother is there, how strong is the bonding, if she,
Yeah.
like, so the risk of physical harm to the children, to the child or the mother,
Yeah.
and the risk of long term consequences also need to be taken into account when people
Yeah.
make these decisions, which I think
Yes.
is largely ignored whenever these conversations
Yes.
are happening.
Exactly. Yes. So again, different things work for different families. Some mothers might have a very difficult birth experience, but be able to breastfeed for a long time. Some mothers might have a very easy birth experience, but struggle to breastfeed. Some mothers, there's actually evidence of nursing aversion in some mothers. Some mothers get panic attacks from breastfeeding. It is not. So again, the public narrative around breastfeeding is that it should be a natural thing that happens very quickly. In my anecdotal experience of motherhood, that has not been the case, that I've seen in myself and other mothers. um, it's a learned skill that both the baby and yourself have to develop. If it works well, it can be very good. They do say breast is best, but actually fed is best. So if the breastfeeding,
Yes.
it's a two-way relationship, breastfeeding between a mother and a baby. If for mental health reasons or whatever reasons it's not working out for the mother and everything has been tried, then you can look for alternatives. That is my approach. You have to be pragmatic about it, because ultimately the thing is that the mother and the baby should have a positive relationship,
Yes.
and nothing should get in the way of that. And whatever helps that should be ensured.
And the end goal of this is long term, like, well-being of both the
Yes,
baby and the mother. We can't just
100%.
focus individually, like only on one aspect of that
Yes,
relationship. It has to be by, both of
yeah,
the mother and the child as
yeah.
a unit.
It has to be bi-direction. Again, I don't want to take away from the evidence that breastfeeding is very, very good for the child. But at the same time, I want to add the caveat that it can be challenging for some people. And where it is challenging, they should receive all the support that they need, including, for example, maybe not continuing with breastfeeding if that is the best option in that situation.
Absolutely. And I think the like every information has to be taken in the context of risk and benefit, which
Yes.
is how I would want to, like, maybe summarize this.
Yeah.
That when we talk about side effects of medications, for example, or like the fact that breastfeeding is happening or not happening, right?
Yeah.
So how do you think, like, when we talk about risk and benefit, what are those risks and what are the benefits potentially? And that decision should be in collaboration, definitely, right?
Yes, it should always be in collaboration. It should be in collaboration with the mother. It should be in collaboration with the with any, if if support with lactation is available, for example, if the latch is not happening. So there's a whole spectrum of things. One is breastfeeding contraindicated, which means you're on some medication on which you cannot breastfeed the baby. In which case the decision becomes about, okay, whether I want to take this medication or not. Have all the other options been tried? If breastfeeding is very important to me, have all the other options been tried and failed? If they have failed, then unfortunately, it's worth a try. Pausing it for a while for mother's mental well-being if she's that unwell. The second thing is, if latch is a problem, or if it is a difficult thing for women to go through. Women have histories of trauma and abuse, and so many of those women might not find the breastfeeding relationship intimate and as fostering bonding. Many women do, but there might be a subset of women who don't, and that has to be respected as well. So if those are the feelings that are coming up for the women, they need to be supported as well. What we do is we end up creating a taboo around these subjects, whereas if you're not breastfeeding, you're a bad mother. No, there are many ways of being a good mother.
Yes.
So
And whether
that
you
just needs to be
breastfeed or
explored.
not is
Yeah,
not the ultimate,
that is
criteria.
not the ultimate criterion.
Yeah,
It can be very good if it works. I think it is wonderful when it works, and I think it's a great way to connect to your baby. But it's not the only way to connect to your baby, and
absolutely.
other ways should be encouraged when that is not working.
And I think it's true for everything in life. You can't take things out of context and just try to label them as right and wrong, black
Yes,
and white. Everything
yes,
has to be seen good and bad within a context. And if some things are not practically possible, it's okay. Like, there are other means
there are other
of
means. Yes.
ensuring well-being, right?
Yes. And luckily now I can only speak for the UK, but I think, brands might be similar across the board. There are good formulas available that, address the baby's needs, sort of nutritional needs in the first 6 months of life. And after 6 months, babies start to get weaned. And actually, there is evidence that once you introduce fruits and vegetables to the baby after 6 months of age, when it is safe to do so, the gut bacterium, grows in the healthy way that it does for breast fed babies too. The only, maybe, you have to be clear about the evidence that you will not be passing on antibodies to the baby. But, with exposure, most children who have a healthy baseline system will end up developing.
There are so many
their
factors
immunity.
in raising a good, healthy
Yeah,
child. I think that even if one or two are not ideal, there are other factors that you can work around, and there
yeah,
are other things
exactly.
that you can work with. So
Yeah,
the idea is to make sure that you're
yeah,
providing as many factors
yeah,
as you can control
yeah,
in the better way, rather than
yeah.
just fixating on one or two.
Yeah, and again, for the most part, here we are talking about women who are really struggling, who have had
Hmm.
trouble, who probably have a diagnosable mental illness, who need additional
Yes.
support. So in that case, holding them to a standard where they need more support to lift them up to that standard, I think that is wrong. So they should be
And
given that support to lift them up.
a lot of times, Sucheta, I've seen people like, immediate family members, not just within the context of pregnancy, but because we are talking about this here, try to shame a mother into
Yeah,
like being an ideal mother or a
yeah,
lovable mother, as if there is like, a rule book that needs
yeah,
to be followed,
yeah,
right? So,
yeah.
like, what would you want to say about that, like, to the
All I want
people
to
who are
say is that
listening?
just because you've become a mother doesn't mean you've stopped becoming a person. As every person has their own needs. In fact, a new mother might have more needs because they've just been physically completely transformed. They, as I said about matrescence, they've just been mentally completely transformed, and they have a small baby to take care of, which all most mothers will have a desire to take care of this child. There are very exceptional cases where that doesn't happen, and that's not the domain of our discussion. But we are talking about the regular experience
Yeah.
of motherhood. So in that case, the because India is such a social-centric society still, and what the experience has, what most mothers will experience is that as soon as the baby is born, during pregnancy, it's all about them. As soon as the baby is born, it's all about the baby. But really, there is this person whose entire being has been transformed, and they still
Yeah.
need continued support. So that is what I would like to tell people within the extended circles of women or people who are giving birth, is that the old time was different. There's different hand-me-down knowledge, but now we know differently. We know better. Women have lived a certain amount of life before they come into the role of being mothers. So they have been people before. They're not just born to produce children. So that support should be available no matter what, especially if somebody is undergoing a major transformation such as motherhood.
Yes. Thank you, Sucheta. That was really, I think, a fruitful discussion, and I think a lot of our listeners must have benefited from it. We have one question from Ankita asking that, does pregnancy-related anxiety OCD disorder go away, and will the person be able to live a normal life again like she used to?
Pregnancy, I mean, it will depend on every single individual, but these are very manageable conditions, is what I would like to say. So, a lot of the times, pregnancy related anxiety and OCD can, if untreated or unmanaged, or even because of the normal physiological changes of pregnancy, can get worse. As I said about the hormones, just after giving birth, your hormones undergo a complete crash right after giving birth. So that becomes a very tricky period during which some symptoms can get exacerbated. So I don't want to sugarcoat it, but at the same time, with the right support, all of these conditions are manageable. With the medication support, with the therapeutic support, all of these conditions are very, very manageable. And just as you were able to manage before any symptoms before your pregnancy, you will be able to manage them again. But the point is to not, just because you're pregnant, to not stop your mental health treatment without seeking expert guidance. So you should always
Absolutely.
be in touch with somebody, and ideally your psychiatrist should have experience with treating pregnant women.
Yeah.
Because as I said, even within the medical community, there's a lot of myth making about what medication can or cannot be used during pregnancy. Yeah.
Absolutely. And I think that should be the take home message, that most of these illnesses are manageable. And if you seek the right professional, firstly. Secondly, if the right approach is taken to treat, most of these conditions can be managed wonderfully, and a mother could live a life very close to, like, how she would want to carry on with, or within her aspirations and decisions and dreams around pregnancy.
Yes.
Thank you so much, Sucheta,
Okay.
for
Thank
joining
you.
here. And anything that you
Yeah.
want to add at the end of it?
No, all I want to add is that, seek support. Pregnancy and childbirth related mental health problems are more common than you would think, but also their management is also available. All you have to do is step out and seek help. And people around you as well, they should be aware as well that you can seek help for these conditions and help is available.
And it doesn't make you weak in any
It
way.
doesn't make you weak in any way. Yes.
Yes. Okay. All right. Thank you
Okay.
so much. Thank you
Thank you.
to everybody for
Thank you.
joining. All right. Take
Thank
care. Bye.